Good afternoon. My name is John Aaron Avalos. I am a BSN student at Indiana State University. This is my presentation on Community Health Needs Assessment and SOAP model for community health. This presentation is for my population-focused community health nursing class. Populations at risk. A population in the community that have identified unmet health and healthcare needs. The objectives for this presentation are to define community health assessment and all that goes into it, such as conducting a community health assessment, the improvement plan, and how it relates to SOAP notes. I'm going to describe what a SOAP note is. You're going to know the acronym for SOAP, know how to identify a subjective, explain objective, and summarize, analyze, assessment. Please take a moment right now to check your knowledge on what you already know about community health assessments and SOAP notes. Please click on the link on YouTube for a pre-test. What is a community health assessment? A community health assessment, also known as community health needs assessment, refers to a state, tribal, local, or territorial health assessment that identifies key health needs and issues through systematic, comprehensive data collection and analysis. Community health assessments use such principles as identify and prioritize the health needs of the community. The assessment is conducted with a multidisciplinary team. You need diverse community engagement. You also need maximum transparency to improve community engagement and accountability. Use of evidence-based interventions and encouragement of innovative practices with thorough evaluation. Evaluation to inform a continuous improvement process. Use of the highest quality data pulled from and shared among diverse public and private sources. What is a community health improvement plan? A community health improvement plan, or CHIP, is a long-term systematic effort to address public health problems based on the results of community health assessment activities and the community health improvement process. A plan is typically updated every 3 to 5 years. Why do we want to complete an assessment and improvement plan? A community health assessment gives organizations comprehensive information about the community's current health status, needs, and issues. This information can help develop a community health improvement plan by justifying how and where resources should be allocated to best meet community needs. Benefits include improved organizational and community coordination and collaboration, increased knowledge about public health, and the interconnectedness of activities, identified strengths and weaknesses to address in quality improvement efforts, baselines on performance to use in preparing for accreditation, and benchmarks for public health practice improvements. Community health assessment and how it pertains to SOAP notes. Healthcare providers use rule of thumb notes known as SOAP, which stands for Subjective, Objective, Assessment, and Plan. Clinicians get subjective information from the patient, including the patient's presenting complaint, experience of his or her symptoms, and collect objective information such as the results of blood pressure measurements, X-ray, and blood tests. After collecting the patient data, the clinician makes a diagnosis assessment and then decides on a treatment plan. The acronym for SOAP is subjective, objective, analyze, assessment, and plan. Subjective data is what is the patient experiencing or feeling? How long has this been an issue? What is the frequency, intensity, duration? What makes it worse and what makes it better? Any past history, family history, home monitoring results, blood pressure, weight, glucose monitoring. Objective data, it's the results of the physical exam, relevant vital signs, what the nurse is observing. The assessment, what is the nursing diagnosis or medical diagnosis? Identification of the problem. The plan, what interventions are done during the visit? What if the follow-up? What medication have been prescribed or changed? What further testing or investigations are required? When will the patient be seen again? Here is a sample chart note. For the subjective, you can use in for refills and review of diabetes, home glucose monitoring, taking blood glucose readings 3 times a week, in the morning only, fasting. Average blood glucose between 70 and 80. Has been trying to avoid sugary snacks, but has just quit smoking, so is finding difficult to stop. Walking 5 times a week for 30 minutes. Objective. The blood work A1C was 7.2, better than 7.3. The LDL is 1.9, blood pressure 118/70, heart rate 72. The assessment, diabetes, A1C is not at the target goal. The plan, provided with information on A1C, diabetes, and targets, provided with support and information related to nutrition and strategies to reduce sugary snacks, reviewed blood glucose testing, and will check postprandial sugars 2 times a week until the next visit. Encourage the patient to book an eye exam, also a foot exam. Increase metformin to 1,000 milligrams twice a day. Repeat blood work in 3 months. Encourage to check the glucometer with blood work. Return in 3 months. Here is an example of a nursing SOAP note. Current condition is COPD with pneumonia, and the goals will be to demonstrate productive cough in a seated position, and the patient will ambulate 150 feet with supervision, no assisted device on level indoor surfaces. The subjective, patient reports that they're not feeling very well. I'm very tired. Objective, listening to the lungs. Chest physical therapy was performed in sitting, anterior and posterior. Techniques included percussion, vibration, and shaking. Patient performed a weak combined abdominal and upper costal cough that was non-brachioplastic, congested and non-productive. Patient given towel roll placed in back of seat to open up anterior chest wall. Strengthening exercises. Patient instructed to hold tissue over a trach when speaking to prevent infection and explained importance of drinking enough water. The assessment is patient continues to present with congestion and limitations in coughing productivity. The plan, continue current exercise plan including CPT, emphasize productive cough techniques, increasing strengthening, exercising reps to 15, attempt ambulation again tomorrow. Here are some additional resources for community health assessments. Please take a moment to check your knowledge about what you have learned today in this presentation. Click the link on YouTube for a post-test. Here are the references for my presentation. Thank you very much for listening. Have a great day.